Is there a cure for fibroids? What are the chances of conceiving for someone who has fibroids?
Do you want me to start?
Oh, sure.
Well, first of all, the incidence of fibroids are very high. Probably many of you, if not most of you, have fibroids and don't even know it. Fibroids are benign, generally benign growths that can grow either inside the inner lining or of the uterus, the actual muscle of the uterus, and outside the uterus. And for the most part, well, first of all, they're benign, and for the most part, they're asymptomatic, but they can be symptomatic. You can have, you can have bleeding, because what happens is that the blood supply to the fibroid as the fibroid grows becomes less and less effective, and the fibroid degenerates, and you get bleeding. And that can, as the fibroid gets larger, and depending also where the fibroid is, it can cause more and more bleeding. So if it's symptomatic, the fibroid can be an issue. As to whether or not a fibroid can affect fertility, there's a tendency, if somebody, for example, is having difficulty with conception, one of the options may be to do a myomectomy where they take the fibroid out. Generally, small fibroids don't, I do not believe, have any great impact on fertility. But when you're looking at somebody who's really having a great deal of trouble, you'll look for every cause. The fibroids can affect pregnancy in that, for example, you increase incidence of breech babies, so malpresentations, sometimes increase incidence of premature babies, and often fibroids may be the source of bleeding during pregnancy, unexplained bleeding during, or what non-obstetrical reason for bleeding during pregnancy. Often I find fibroids incidentally as part of a routine ultrasound during pregnancy, and we'll find out that there's fibroids there. Or on a physical examination, the uterus may feel a little irregular or larger than it should feel for a normal non-pregnant uterus. So those are the things that I'll look for. But overall, for the most part, fibroids are things you do not have to worry about, unless they're growing quickly. And if they're growing quickly, then I'm worried about them, because they have a very small but still definite potential for developing cancer.
3 in 10,000 will develop into cancer. 3 in 10,000. The fibroid location is often seen by the symptoms. Pain, for example, if we're inside the uterus now, the wall is myometrium. On the other side, going into the abdomen, pedunculated fibroids twist and they cause pain. So very often the pain will be a sign of a pedunculated fibroid, the easiest ones to remove from the outside. Intramyometrial will make a large irregular uterus. The most serious fibroid is subserosal. Remember, subserosal? That's ones that are indenting in the inside of the uterus, and when a vessel goes over that fibroid, it can't contract properly, so that's why they have hemorrhage. And they can sometimes be reused now, hysteroscopic myomectomy. You can actually look inside the uterus and have it scraped off to the wall. So they're getting very advanced in being able to do, and I've seen some fertility cases where they actually have altered the fertility. But once again, it's hard to imagine. It would have to be a pretty big fibroid to obstruct the openings of the fallopian tubes, but it can cause malpresentation. Yeah.